So we've not really addressed women on this one, but that's Jada Pinkett Smith.
Yeah.
Personally, irrespective of what is said about this couple, I really respect them and appreciate them for everything
100%.
they've done.
100%.
I believe she's been very public with her alopecia.
Yeah, areata. So basically, alopecia areata is a condition. It's an autoimmune condition. Basically, medically, I'll say your body reacts against your own cells. It rejects your own cells.
Like autoimmune?
Autoimmune condition. So that's the reason people feel it is not something which is acquired from someone. It is your condition, and it may get triggered with stress or other internal body issues. But it's most of the alopecia conditions are controllable.
Okay, but it's genetic.
It's not genetic. It's an autoimmune condition. There's a possibility no one in the family has it and you get it.
That's true for all autoimmune diseases.
Mostly, yeah.
So, like people, I think lupus is a common one, right?
Lupus is very common. This is skin condition with a lot of internal physical
Doc, I see a lot more autoimmune stuff around me now than I did 10 years ago. I don't know whether it's because I'm 32 and things kick in their 30s or...
See, there are two things. What I feel now, because of the awareness, because of the access to the news across, because of social media, and also the adulteration of the entire environment and the lifestyle. Everything. Heart attacks, 10 years back, I don't think so. In 20s, 30s, we were scared ki heart attack. But now we start seeing a lot of people over there. So every health condition is getting accelerated because of this.
Would you say that this alopecia that Jada Pinkett Smith has, this is the most common women's hair problem?
No. Very common. This is not even... I'll say it's a very minimal, which is it's just because of a celebrity it gets hype. But yeah, it's there, but it's not that common. Okay. Normal female would go through a same phase of male pattern baldness, but a diffuse thinning, not a complete bald patch, but a diffuse thinning which starts showing up on the scalp because of multiple hormonal issues. Majorly, you'll see it immediately post pregnancy. You'll see a lot of people having PCOS, thyroid issues, perimenopausal. All these things affect because the hormonal imbalance is happening.
Okay, so of the 100% of women that exist in the world, how many of those 100 would be having hair thinning related issues?
See, I'll not have the exact numbers, but for sure more than 50% would be facing hair thinning issue at some point of time.
Okay, because
for sure.
As a guy, when you think of hair thinning, you only think of other guys. You don't really think of girls.
You'll not think, because in a guy you see a baldness which is very evident. In a female it is not evident. It's not a bald patch, it's a scalp thinning in the center. And now in a female you can easily camouflage and hide it, but internally they get affected for sure.
So the game plan is the same. You just take care of your hair and your lifestyle. Okay. Any tips for new mothers who are dealing with hair thinning?
See, any new mothers, so when a female is pregnant, they are in a protective mechanism to protect the baby inside. So the hormones are in that way. Once they deliver, the hormones which are protecting you changes to completely. There's a loss of estrogen and everything. That causes immediately after 2-3 months postpartum, you see a lot of hair fall happening. And during pregnancy, women will always comment that we had very healthy, luscious hair during the pregnancy period. So that's a hormonal change. Just maintain it with proper diet, proper sleep, proper exercises, everything, and it will stay. It's a smaller phase. It's a phase of telogen. Only thing, when it gets continued for a longer period, there's thinning which actually sets in.
What is longer period?
More than 2-3 months, more than 4 to 5 months, I'll say. If it is continued for excessive hair fall, see a dermat, see what needs to be done. If there are any deficiencies on your body, needs to be corrected.
Do you think a woman's scalp is most prone to hair thinning post-pregnancy?
Post-pregnancy, PCOS, menopausal, all these are same hormonal issues. Your protective women hormone, the estrogen, goes down in all these things.
You see a lot of cases of older women who are dealing with menopause.
Yeah.
So then what do you have to do in that case?
We have to see what is the way we can help in sustaining the hair for a longer period and maintain the thickness and the quality of the hair, depending on so all other additional factors like diet, protein, nutrition, everything needs to be measured properly. Then there are other non-surgical therapies also available which helps in sustaining the hair follicle in a better way, like PRPs, QR678, exosomes. All these therapies are available, designed specifically for individual patients.
Okay. PRP
is basically platelet-rich plasma. It's your own blood. We take your blood, separate the highly concentrated platelets, which has good growth factors, which gives more sustainability to the hair, to the internal damage happening.
Okay. And you inject it back in.
Inject on the scalp back.
Painful?
Not really.
Easy?
Yeah, 30 seconds to a minute.
Okay.
That's it.
And this is a scientifically proved technique.
Yes,
And
yes. It gives a good quantity of growth factors, such as multiple other therapies, which are the exosomes, which are recently these are nanovesicles which reactivate your dormant follicles. All these theories are there, but used in a customized, tailored approach to an individual patient is what is required. Everything cannot be given to everyone. Every treatment will not work with everyone.
little whack question for you, okay? Um, the one thing I know for sure is that the world is becoming more and more bald. Okay, now I don't know whether this is because of genetics or lifestyle or whatever. So I often think about my children, and I'm pretty sure they'll face balding by the time they're 25, 30.
I Depends on the genetics. The one you marry, what genetics she carries, what you carry, all these genetics mixing and matching, and the lifestyle. Everything will play a role eventually. Also,
Okay. Uh, but I also know that biotech is evolving very quickly.
right.
So in 25 years, while balding becomes a very normalized thing, I also think the
The
solutions are.
solution will be much better. There are new molecules coming actively, though not as per what is shown on Instagram, but there's a molecule PP405. So it doesn't act like a minoxidil vasodilator or a finasteride. It reactivates the dormant follicle. It's a messenger which reactivates your cells which are dying, which are sleeping, I'll say, in a layman's term. Seen good results. Safety was good. In almost 30% of the patients, they could see a good 20% hair growth in 4 to 8 weeks. Improvement in the hair density. What Instagram shows is like in 8 weeks, a grade 7 bald gets a head full of hair. That's AI generated. That's not possible. In adjuvant with other treatments where we want to avoid hormonal tablets or anything, this would be a good option. But such many more things would come into practice.
The deal with new technologies when it comes to biotech, I believe, is that they need to be studied a lot for their safety and long term side
Long term,
effects.
yeah. So any new technology or any new medicine which is coming, it goes through a multiple phases of trials, right, from the mice or rabbit to something, and then it goes through human trials, volunteer human trials, observing them for a longer period. It's not immediate side effect. It can be a 4 year, 5 year, 10 year down the side effects also. So we have to observe that, and then it comes into practice.
So when you go for hair biotech conferences, this is the kind of technology spoken about?
There are certain topics, and then there is small evolution happening on day-to-day basis.
Okay. So in 2025, the most common and effective one is hair transplants.
As of today, yes. See, it's again not only hair transplant, a combination treatment. That's what I always say. Uh, it's hair is not something which is one size fits all kind of category. You see a lot of people. Nothing against anyone, but a lot of people now fill online forms, get a medicine kit which is combined with medicine, shampoos, conditioners, serums, lotions, and everything. Some mixture of allopathy, some Ayurvedic, some homeopathy, and promoted by good celebrities. So people in India for sure swear by them. And if they are saying, though they might have not even used it, but they are promoting, people use it, and then that creates an high expectation from an individual, which is not practically possible. I'll suggest go and evaluate with a doctor, understand, because every body, every biology is different. We have to customize tailored approach. What is the deficiency? Unless you examine a scalp, unless you see the hair, unless you check the strength of the hair follicle, what is the lifestyle analysis, everything is not evaluated. One form for everyone wouldn't work.
जहाँ पैसे वहाँ scam.
Possible. Not a scam, but it's an aggressive. See, internationally, I've been told that a lot of hospitals outside India also do a lot of things where doctors meet just for a few seconds, where you are already pre-evaluated, pre-diagnosed with it. So I guess that work ChatGPT would do much better now. But rather than when you have access to doctors, go and meet them. They'll guide you properly in a better way, and there's something which might be missed out. Multiple combination of medicines would be contraindicated in few. There would be some reactions which might come, which you may miss out on a form.
Hmm. Hmm. My personal opinion here is that if there's anything going wrong with your body, you'll get warning signs
Yeah.
always early.
Yes, yes.
It could even be possibility for cancer. You'll get warning signs early.
100%.
Go to a doctor.
For anything, at least visit a doctor, have more clarity. People reading on Google, people reading on ChatGPT, it creates a more hypochondriac nature, I'll say. People start fearing about those symptoms without having them. And then they start saying that these are symptoms already there in their body, which is not actually there.
I'm from a doctor family, and Google, I think, became big in India in 1999-ish. So I remember my parents discussing how Google has kind of become an enemy of doctors because everyone diagnoses themselves off of Google.
They
But
diagnose it, yeah.
that was 1999. In 2025, would you say ChatGPT is the new?
ChatGPT and Google, or all of these AI platforms, they diagnose, they decide their treatment, they know their side effects, they just come for an approval. And mostly, though, they don't even know.
There are medical dangers of taking medical advice from ChatGPT.
100%. And they, as a disclaimer, they would also mention that. I'm sure they must be mentioning it. Please visit a doctor.
ChatGPT says
Yeah,
that.
100%. They will mention it. They have to. Because examination is one very important part in any medical condition.